Peptides are powerful and often misunderstood.
But we're here to change that one conversation at a time.
I'm Dr. Kylie Burton.
And I'm Jess Bricky.
This is Pep Talk, Peptides Unpacked, science made simple, results made real. Our fun fact for the day is insulin is a peptide, and we've been using insulin for over 100 years now. And our special guest that we have has been using peptides for over 7 years. So if you believe that peptides are new, I would hope that we can dispel that belief. It's just that peptides have become the talk because now we have more accessibility to them. So I want to introduce to you our special guest, Megan Hermazdi. She's a nurse practitioner specialized in integrative hormone and metabolic health for midlife for women in midlife. As a cancer survivor and peptide therapy expert, like I said, she's been using them for 7 years. She helps women navigate perimenopause and menopause using personalized hormone therapy, advanced testing, root cause approaches that support energy, longevity, and whole body wellness. So, Megan, welcome aboard.
Hi, thank you so much for having me.
I'm so excited to hear this story, Megan. So, if you don't mind, Kylie mentioned that you're a cancer survivor. Do you mind telling us a little bit about that part of your journey? And is that what brought you to peptides, or was peptides like how did they come into your world?
Sure. Actually, I was 28 years old, and then I just came to United States, and I was under so much stress. My boys were 3 and 9, and then after 4 months here, I didn't have my period, so I went to doctor, and they're like, "Well, let's have ultrasound." And the next day, I found out I need to have surgery, and the next I found out I have ovarian cancer. So
Wait,
surgery
did you
was
say
successful.
did you
28?
say 28 years old?
28, 28.
Wow.
Yeah.
Holy.
So I've
I
all,
just got goosebumps everywhere because I just saw you had that and you had your children like
yeah,
young. Thank
yeah,
goodness. Wow. 28. Okay. So quickly diagnosis and in and having surgery.
yeah. It was
Ooh.
very scary because at the same time, I didn't know English. So all I heard in my answering machine was check with UCI Cancer Center. And I was like, oh, I connected that. I had overectomy, and now I have to see cancer specialist, oncologist, and with my experience, which I was at the LVN in Iran, and I was like, well, okay, probably I'll be dead because ovarian cancer people, they don't survive when they were diagnosed. So anyway, that fear was real, and I went through it, and then I survived that. And then 5 years later, I just celebrated my being cancer free. Then suddenly I find out that I have colon cancer and then I had the colonoscopy. They removed 5 polyps. 3 of them were the same cancer, and 2 of them were benign. And I survived that one. But then after that, my problem started. So,
After
So
after cancer
because in
twice,
case
now
that
my
was
problems have started.
right, in
Okay.
case that wasn't, I just adore you. Okay, I had two types of cancer. We had colon cancer, we had, uterine cancer, but then the things started. Wow. Okay. Did you have any chemo or any follow-up treatment, or were they just surgical removals and that was the procedure?
so that was surgical removal, and my doctors, they sent the tumor to have pathology done in New York, one of his own friend, to making sure they are right. And he was like, this type of cancer has to be removed surgically. We don't have any chemo radiation for it. And it's for older women. I don't know why you have it. And it has to be metastasis. You're lucky that is not metastasis. So anyway, in all around, I was just a lucky person here. And it meant to be that I live and I learn about functional medicine and peptides, and I can help other women to overcome what I experienced.
Wow. So when you say that the problems began after you had colon cancer, what kinds of things were you experiencing?
Yeah, so that was a problem. I start gaining weight like crazy. So my size will keep changing from 6 to 8 to 10 to 12 to 18, 188 pounds. Constantly going to my doctor and complaining of muscle pain, insomnia, constipation, migraine, depression, anxiety, you name it, and irregular period, cramping, PMS, all of it. And of course, I was getting all the medications possible. Let's try Lexapro, let's try Cymbalta, let's try Topamax, let's try this and that. And because my body was toxins, full of stress, inflamed, my gut wasn't ready. I was showing all the side effects of the medications possible. So I wasn't tolerating them. They were also another toxins to my body.
Sure.
And until I become a nurse practitioner, and I was working night shift nurse and for 3 nights and extra nights, and I have my two little boys that I couldn't sleep during day, and also I was going to nursing school during days, so I wasn't getting rest. I was under stress. I was eating whatever I could find and
Yeah,
like on my way.
you were surviving. You were
I was
surviving.
surviving.
Yeah.
And then living on a budget and all this. So anyway, short story, I was like, until I become a nurse practitioner and I start practicing at the internal medicine office as a nurse practitioner. And I find out, okay, something is wrong. My patients are coming back to me the same, and they'll keep telling me the same problem over and over. And I'm just giving them medication or increasing their dosage or adding to their medications. And it's something wrong. So I was looking for answer. And every day I was exhausted. I was going to boot camp. I was dieting. And I thought I was doing everything right. I wasn't able to lose weight. I wasn't feeling well, but I was pushing through life as I have to, and all of us have to. So then suddenly the book from Dr. O'Brien, autoimmune book, autoimmune fix, was on one doctor desk who on that Friday, I took her desk to make sure I do my admin time. And then I remember I just leaned back on my chair and I grabbed that book and I started reading. I did not put this book down for the whole weekend.
I'm familiar with the book. You must have been check by all these boxes. This is me.
This is me. And I start reading and reading and reading. And it's like, okay, okay, okay. And I start implementing it to my life. So, okay, let's do elimination diet. This is the answer. I start eliminating food. And then I started ordering food sensitivity, food allergy testing through Quest for my patients. And you can imagine where this goes. I was getting a slap with patients that were getting bills and insurance is not covering. Why you need to code it right or whatever, and it's expensive. So I learned that lesson to not do that.
Yeah.
Even though it can be helpful, it's like, wait, one, the patients who you were seeing were anticipating to use insurance. And two, yeah, it's just a whole new demographic when you enter the functional medicine space in a lot of ways. But in a lot of ways, like they've had to go through something where you went through to where they opened up their eyes to see, okay, there's something different here. It's worth paying cash prices for this because I'm getting different results.
Correct.
So as you started to incorporate the dietary changes, did you see much change with your autoimmune diet yourself?
Yes, I started losing weight. I felt better. My muscle aches, which they called it fibromyalgia, was gone. I felt better. I slept better. Constipation was better. Diverticulitis was gone for a while. So, yes, I felt better. And then my patients who wasn't getting pregnant for 3 months start getting pregnant. The other patient was coming to my office and he was an elderly man and he was kind of like on the deaf side. So he was loud and he was like, I don't know what are you doing, but my A1C is coming down. So you keep doing what you're doing.
Which
That's
gives you
great.
a light of like a spark as a practitioner. It's like, wait, I'm helping these people out, not just helping myself. So you did the diet first. What was the next step in the process?
So the next step was me registering through IFM. And I was like,
Mhm.
okay, they removed my ovary and my colon is messed up because of all the things that I went through and stress and eating and all this. So went through IFM, took their courses and hormone makes sense. And then I find out IFM is great and I learned a lot. However, I wasn't really able to order the hormone, prescribe the hormone through them and to their education. So I took class through A4M, and A4M is kind of more extensive and they go farther. So I learned how to prescribe hormones and then I start ordering hormones and I prescribe hormone for myself because not doctor would prescribe it for me because I had ovarian cancer.
Right. Well, and
So I
people, I
use my
think that's
medical.
I want to interrupt you for 1 second because you brought an important point up because I know we're not necessarily talking about hormone therapy, but I want to repeat that. Just because you have had breast cancer or you've had, in your case, you had uterine cancer does not
Ovarian.
automatically
It was
mean you are
ovarian.
not
Yeah.
eligible to get hormone therapy.
Correct.
Right.
Yeah. But nobody will risk it
Of
and place me
course.
on hormone, which my body needs it. So my medical director took the chance and ordered me a hormone and I started on it. And of course, that changed everything. PMS was gone. My period became regular. I slept better. My anxiety was gone. Mood swing was there better. And I had energy to exercise and all this. Now, when peptides came on board, I was like, okay, things are good. However, I need that um, more of the energy to get to my exercise. And I need that, and still I need that libido help and things. So I was looking for answer more. And then I learned about oxytocin. That was the first peptide I learned about. And I was like, okay, let's try that one. So first of all, I got the injection and I got the hot flashes and
Yep.
palpitations
I've
and
been
said,
there.
okay, yeah. I was like, okay, that didn't feel good. But
Yep.
then I learned about nasal spray of the oxytocin and it was amazing. It has been amazing. It has been helping a lot of my patients. Um, it's so peptides are not about chasing the youth or fixing something broken. They are signals, and that remains the body how to repair itself, how to regulate itself, how to feel safe again, and we women in midlife. When our metabolisms, hormones, nervous systems, and like all is like going KO is not doing their job and they're more full of inflammation. It's like it, they come and they help us like kind of as a support, again as a supplement, but still our cells have to be ready for it. So this if the signals peptides are signaling and the receptor is not there and the receiver is not receiving, is not going to work. But it's great to use the peptide when body is ready for it and in a systemic way.
Are we talking, I mean, so when I talk about people, for example, using GLPs, um, everybody's chasing the weight loss, right? That's the big
Yeah.
thing people are chasing. And obviously, we know they are so much more than weight loss, what they're doing to the body. And I tell people, listen, you may not have the lifestyle tools in place right now that you need to support your body. This might be the tool that you need to help you make those better changes. Or maybe you're like me when I started, there was no room for improvement really in my life. So the peptide just got everything signaling again. So when you talk about having the cells ready, are you talking about those foundational pieces? People need to be ready to do that kind of stuff. Are you
Yeah.
talking about like some sort of, I mean, we've worked with, Kylie and I both worked with companies in the past where some of the focus is restoring cellular our body at a cellular level. So what are you talking about?
Yes, restoring body at the cellular level is really important. And it's all about what we were doing. Like when I started losing weight, there was no peptide, there was no GLP-1 at that time. So all I did was just the base would cleaning my diet, getting myself to sleep, balancing my hormones, detoxing my body, and all this. And then when GLP-1 came, of course, it makes everything not, I don't want to say it is a shortcut, but in a way they work beautifully by lowering the inflammation. They are the peptide we are missing in our gut, and we are replacing it, so it helps. And we are finding day by day, every day, that how beneficial they are for us. So it's working for cardiovascular, diabetes, brain health. It's not just about weight loss. We shouldn't be looking into it just about weight loss. Even, yes, now insurance is denying medication for the patients that don't have BMI of more than 30 or being diabetes. But if you look into the medication, sometimes even the um, BMI of 23 patient whose body is inflamed can benefit from one round of GLP-1 to just get the inflammation down.
Yeah, just a little tiny bit, which is microdosing, and the fact that people are talking about that so much now is really fantastic. So,
Not just the microdosing piece, but the personalization piece.
the personalization
And
piece,
and
sure.
that's the part that our telemedicine company just added in, is like you can literally get personalization pieces down to the unit.
Mm-hmm.
And I don't know if they got the oral drops one's coming in yet, but they do have oral drops to where you can just do like one drop.
Yeah,
And when you're saying that GLP-1s are so great for weight loss, one of the things that captured my attention, and I know Jess's attention as well, is like the nervous system component, the brain
The
support
brain.
component.
yeah,
There are so much more things that this one peptide can do, and even the GLP GIP combo, they're just so beneficial for our health. But it's all about getting it at the dosage that's right for the individual.
yeah. I ask my patients, and they're like, yeah, I don't crave wine anymore. I don't crave beer anymore. I don't want to smoke anymore. And
Hmm.
it's I don't want coffee. Coffee doesn't taste anymore good for me. So it's really
It,
interesting how they're changing.
we did a podcast with a good friend of mine
I was
who is a
just gonna say
recovering
that.
alcoholic. She's been sober for many, many years, and but it's still a fight. Like every single day she would still come home from work and still have that fight, the urge and the thoughts and everything around it. And she started microdosing. We talked about it, and for the first time in her life since she was a teenager, her relationship with alcohol started early in her life. Her brain was quiet. She wasn't fighting that anymore. Now, it isn't necessarily, I want to say this, it isn't going to be somebody who's in active addiction isn't going to
Yeah,
take a GLP and suddenly come out of active addiction. But those people that are in the throes of their sober life, their cigarette-free life, whatever it is, even food addiction,
correct.
that quieting of the signaling in the brain that's just constantly screaming at you, the peace that comes with that for people has been remarkable. And her story is one of many that we probably all heard that's just absolutely incredible. It's, again, so much more than weight loss.
Yeah. During perimenopause and menopause, that we have inflammation all over, which is in our brain too. We feel like we have ADHD.
Hmm.
So with GLP-1, I found out like most of my patients, they don't feel that way anyway. So they feel calmer and they can concentrate, and the brain fog gets better. And of course, hormone balances has its own place, and it has to happen, and everything else. However, those molecules are really, really powerful molecules, and we shouldn't ignore how powerful they are. And they work beautifully, and we should really use them wisely and the way that body works with them.
I am on my own HRT journey. It's been a year now since I've been doing that, and one at a time, slowly. I had to have a partial hysterectomy, so I thankfully I didn't have to do progesterone. Um, would you say if you work with both HRT and you work with peptides, and you have somebody that comes into their office and they're a candidate for all of the above, peptides
Yeah.
and hormone replacement? Is there typically an order that you think that people do better doing one first and then the other? Because I don't think it's personally, and you may see it differently, it's a good idea to do everything all at once because you don't know what's actually working when you throw everything on at one time. You don't know what to adjust if you need to. But is there one that you would do before the other?
So to answer your question, it's very complicated. And also, budgeting is important too. Those peptides are expensive, hormones
Sure.
are expensive, supplements are expensive, and we need to consider how patients' budget is at the same time to not put more stress on them.
Hmm.
Because if we start from the foundation is more important. Let's get their sleep. Let's do the uh, saliva hormone testing. Let's find out how they're detoxing. Let's clean up their diet. So when we have done all of this, and then I would replace the hormone first, because peptides turn to hormones like insulin. Insulin is a hormone too. So when we replace the hormone, which is a larger molecule, and the receptors are more re, um, ready for them. So when we replace the hormones and what body is familiar with is needed. Now peptides are kind of synthetic and they've been built in a lab, right? So and we are sourcing them in a place that making sure they've been triple checked and making sure they're pure and making sure they don't cause harm. And this is really important, the sourcing of the peptide. However, when we introduce it to the body, we have to introduce it when body needs it. For example, let's say AOD 9604. So I just don't come and slap the patient on AOD 9604 out of blue. So I'm making sure everything is good. Their hormone is balanced. Now, look in their GLP-1, I put them on. Now they have that extra of the belly fat that they can't lose. And that body composition signaling is there. So then I added AOD 9604, right? And then I'm making sure they injected in the morning, they injected fasting, they go for a run after that, they don't eat after 2 hours, because that peptide wouldn't work if they don't do all of this. The same
Right.
as thyroid hormone. I don't know if I answered your question.
No, I think you did. I think really it does come down to that's a big part of what we talk about. What is your individual needs? Because everybody's journey is a little bit different. But I think there's a lot of women that listen to this podcast that are at premenopausal, postmenopausal. Maybe they've had hysterectomy and they've been thrown into it really quick. And they are gaining weight and they have a ton of brain fog and they might need the HRT support. Maybe they do or they don't have the lifestyles, but they don't know where to begin. And you're right, budget does matter. I can remember years ago sitting in a class and it was one of many functional classes that I took, and they were putting on these massive protocols,
Yeah.
massive, like looking for their patients to be spending six, seven, $800 a month on these endless month-long, like year-long, longer journeys. And I raised my hand in the class and I said, but what about the patient that comes to you? Because we were learning this protocol, right? What
Right.
about the patient that comes to you and it cannot afford all of that? Do you know what the response was?
Mhm.
Well, then they're not your patient.
Yeah.
Well, that's not what we signed up for. Like we signed up to help people. So that doesn't matter if you do or you don't have money. We have to find a way. If somebody can't afford six, seven, eight, $900 a month just for supplements, what do we do? So
And
the
then
budget's
to
a big
to
deal.
pop the pills, I'm not a pill popper,
Yeah.
but I'm also like not perimenopause and menopause, thankfully. But at the same time, like I want to be at the best I can be. So I'm looking at more of the peptides for more of a cellular healing, more of a being at my game, my top of my game. Like my brain, after what it's been through the last 2 years, I'm on methylene blue. My tissue, my gut, like after I don't have symptoms, but I know that at the cellular level, what these things are doing, and I'm like, I could be on these for a long time because I know what they're doing at the cellular level, even though I might not feel any different. I I want them to be at my best. So there's a different perspective, a different approach. One, healing, and
Right.
two is let me be at my best for as long as I can be. And that's the fun part about peptides. It really is what do you need? What are your goals with them? And then let's implement them. Do I buy hordes of supplements anymore? Nope. In fact, I probably just dumped 3 to 4, maybe even $5,000 of supplements from my supplement cupboard and got rid of them.
Mhm. Yes, peptide.
The financial shift, like it's a financial shift too, and I would much rather put them in something where I only need minimal dosage to get maximum results. And that's like so fun when it comes to peptides. So if you guys are cool with it, Megan, I want to shift back to your story because I know when you text or you sent me a message, you said, I've been cycling PT-141, CJC Samorelin, Tesamorelin, and nasal Samax, nasal oxytocin, which we previously discussed. We've done BPC 157, TB 500, which is also called a Wolverine stack, T4 AMD, ARA 290. You've not only helped yourself with this through helping things like sexual health, ADHD, anxiety, thyroid, metabolic health, osteoarthritis, and RA, gut health and energy, and so much more. Um, Walk us through your peptide journey specifically about peptides.
Sure. So BPC 157, TB 500, they're really good for gut health. And if you're dealing with Crohn's disease, with ulcerative colitis, you wanted to add KPV to it. And there are the oral, there are sublinguals, there is injection. My mom
And the
had,
capsules.
yes, there are capsules, and they're good if you take them orally, because not all the peptides you can take them orally and they'll be effective. And then, but BPC 157, TB 500, KPV are one of those that you can take orally. And then my mom had the shoulder surgery and shoulder replacement and knee replacement, and she's 74. So
Mhm.
I put her on BPC 157 TB 500 injection and topical CHK, CU, and hyaluronic acid topical. In a month and a half, she was done with PT. She was washing her hair. She was driving. Her ortho was even surprised that, oh, you're doing much better than my young people. Her
And then my
scar,
young people.
yeah, her scar was healed. And it's amazing like how this molecule work. It's amazing how do they work. My friend had facial surgery, and then I put her on BPC 157, TB 500, and CHKU copper. And she healed within 2 weeks. She was back to work. No bruises, no swelling, no scar. And she went back to work, even though it was in her eyes and around her face and everything. All good.
Yeah.
Remarkable.
Yeah,
Right?
if you're in like have surgery, or if you've been injured, if you're weightlifting and you're constantly building the muscle and tearing the tissue apart and building it again, like you need BPC 157, TB 500. I'm not as familiar with the GHKCU, but I'm thinking like one, my hair's thin. I know it's a hair product. It's pretty thin. I'm postpartum, have three kids, 4 pregnancies. And then I'm thinking I don't know if this is possible, but stretch marks, can we do something about those things?
Yes. Add it to hyaluronic acid, the powder, and just apply it. And it doesn't, it looks amazing. It causes collagen building, scar thinning, and it heals the tissue. I use it for people with bed sores also. So I use the BPC 157 TB 500 CHKU with bed sore. If they
Ah,
back
healing.
on the bed sore area, that is really hard to treat, because at that point, like, they develop candida and bacteria and things. I inject
Yeah.
L31 around it. Um, so those peptides, oh my God, you can do
They're
a lot.
amazing. What if you were, so the GHK can be a spicy injection. So you have talked a lot about putting them on topically. So a lot of people that are dealing with hair loss, hair thinning, if they do a little micro needling, kind of even one of those little rollers, kind of little prickles, and then they rub that on there, that's really beneficial. When you were talking about your mom's scar or anybody else's scar, or even when Kylie was asking about um, stretch
Stretch
marks,
marks.
would you do the same thing? Would you just put it on topically? Would you do a little micro needling first and then put it on topically? Or would you do the injection, which is for some people a little bit harder?
Injection, even if you dilute it more, and also making sure it's room temperature. And before taking it, you take Zyrtec or Claritin, you wouldn't feel the spiciness of it. But you could do the injection if a scar is very deep. So for patient who had laparoscopy and surgical pain, and it was old, and I sent to pelvic floor therapy and chiropractor to kind of break down the scar, but I had them to do the injection before going to do that. Those are yes, you can do all of the above and see which one will become more effective.
Is it more effective if you're doing an injection? I asked this just literally came into my office last week. I have somebody who had she had a fully mommy makeover. So she had the tummy tuck, and she had her breast lift and augmentation. So she's got an anchor scar, and she keloided at the bottom of her anchor scar. And it's been a year now, and that is a really thick, it's really bothering her. It doesn't hurt her. It just aesthetically, she doesn't like it. So in a case like that where somebody's struggled with a keloid, they're a year afterwards, would you inject to that area
No,
or does it matter?
I would inject it to the fatty tissue.
Okay, so still a belly shot.
Yes.
Yeah,
Yeah.
okay.
The reason
Wow.
the scars are poor circulations, and
Yep,
want the blood vessels build up and get the circulations to them and kind of break down
from
from there.
underneath.
Uh-huh.
Yeah, that makes a lot of sense.
Yeah.
Remarkable.
All right, we could sit here and pick Megan's brain for a long time when she's like, I need to learn more. I'm like, girl, you don't need
No,
to
you
learn
don't.
more. You know everything.
Yes.
Um, Megan, if you were to say something to somebody who is interested in peptides, taking them for themselves, what would you say to them?
Taking it for themselves. Um, I would say first fix the train, making sure your body is ready for it. But work with somebody who are familiar with these molecules. As I said, they are really powerful. And you cannot blindly just put it to your body because there is blood work. For example, if you want to use CJC or tesamorelin or epamorelan because they are growth hormone, you want to make sure your blood test has been checked for IGF-1, making sure everything else is ready for the body to add that growth hormone to it, right? And then it's it's pretty tricky. So I would say just get a consultation, fix the underlying cause first, and then go with the peptide that would kind of help to expedite the process and help you heal faster and better and in the right direction.
That's great advice. I think one of the biggest takeaways from what you just said is the consultation component. We have a lot of people out there that are self-diagnosing,
Yeah.
self-medicating, and playing pharmacist in their kitchen and getting unsafe research grade peptides that probably have things in them that shouldn't be going into our bodies, but they're doing it because they're either have FOMO, their friend did really well on this and they don't want to miss out, or they think that they're reading their own symptoms and this is going to help them, but they're powerful, as you said, and we really need to be careful with what we're doing. To work with a practitioner that knows what they're doing is crucial.
Yeah. And body is very forgiving and try to heal itself and compensate and work it through. However, at some point, it depends on the age, it depends on what disease we have, it depends on where the problem is, it can give up. And we don't want that. And it is really important we do the safe practice than harm the body. And when we harm it, then it's hard to get it back. So, um,
Right. All right, guys. Thank you so much for joining us, Megan. I know we got to get her back to work. So, yourintegrativehealth.com is where you can go find Megan. As far as consultations and support through this, that is one of the reasons why Jess, myself, and I know Megan's going to start offering our telemedicine platform because there's two options to get started. One, if you know what peptide you want, you can just go to the link and order your peptide. If you would like to have a consultation with a peptide expert like Megan, I believe his name is Dr. Wagner, you can actually now book a call with him for only $50. And that too will be at the link in our show notes that you guys can go grab access to this and talk to somebody who knows peptides very well, who can help you decipher exactly what it is that you need to get started. And that's to get started. Once you order your peptides, you have access to that same support team through our telemedicine company. So you can jump on a call, you can jump on your patient portal and ask the chat really quickly. And I know even on a Sunday afternoon, one of our clients asked a question and was answered within the hour. So they have great support on that back end from experts that know their peptides and to help you utilize peptides to get the results that you want, whether it be like myself, just to be at my best, or whether you're looking to conquer a specific set of symptoms. So that's one of the reasons why we love working with our telemedicine company is because you do get that incredible care alongside the top-notch elite peptides themselves, which we'll get into more information down the road when we're allowed to talk about these really cool new announcements that they've made. So Megan, thank you again for joining us. Again, go to yourintegrativehealth.com and we'll see you on the next round. Jess, how do they reach out to you?
Well, for right now, they're still finding me on Instagram at Jess B. It is a mouthful to say, but you can also find me on my website, b2bwithjess.com/peptides.
And you can find me at drkylieburton.com. Whether you're looking to order peptides yourself, jump on that consultation we just discussed, or if you are like Megan, myself, and Jess and want to offer these to your clients or even just to your friends as an affiliate business, get all the information at drkylieburton.com. And we'll see you guys on the next episode.